Everybody. We appreciate your patience with a little bit later start. We were supposed to start at 2:30, but we'll start now. On behalf of Highmark Home Care, I want to welcome everybody for attending today's presentation on the Physical Health Choices contract implementation, which will be coming up on September the 1st. The reason why we're doing this presentation, we want it to be a service to the General Assembly's offices, both district and in Harrisburg, in the event that you get constituency calls. If you're not already receiving them, you probably will receive some calls about this over the next upcoming weeks, and for that matter, maybe in the next couple of months. So we hope that this presentation will provide you with some information that will be helpful at the district level in answering questions of constituents who are going to be impacted by changes with this implementation. My name is Joe Glinka. I'm the Government Affairs Director for Highmark Home Care, and I'm joined today by my colleague and Associate Counsel, Hannah Baldwin, who was very helpful in putting together today's presentation. So I would ask that if you have a question, we certainly would be able to answer those. Please put those in the chat, and we will get those answered to the extent we can. If we run out of time, we will certainly make those answers available through our website. And speaking of which, this presentation is being recorded. We will post this to our website and or our YouTube channel in the upcoming days following this presentation. And we have some additional resources that will be made available through our website as well for your reference in an effort to be helpful, again, with regard to this transition. So again, welcome everybody, and we'll dive into our presentation. Hannah, can you advance the next slide? So these are some of the items we're going to be talking about today. A little bit about who we are, because we're going through some changes as an organization as well. We're going to talk a little bit about the Health Choices program, I should say programs in medical assistance in Pennsylvania, with a little bit of information on the new contract as far as an overview is concerned, the timeline that we've all been living by on the Physical Health Choices MCO side of things, what the current Health Choices map looks like. Many of you are probably familiar with that, but we'll talk a little bit about that. We'll talk about current and future state of the MCOs who are going to be available, right? 5 zones, and who will become available in effective September 1st. And we'll do that by zone. We'll talk a little bit about stakeholders in this space and the assistance they can offer to the Medicaid consumers who will need to make a change or who may want to make a change of their MCO. A few closing remarks and some key contact information. So that's just the structure of our presentation, and we'll proceed with the next slide. So who are we? Many of you may have heard of an organization called Gateway Health. Highmark Home Care is formerly known as Gateway Health. And the reason for that was for many years, and you can see that we've been around for 29 years in the Medicaid space, 16 years in the Medicare Advantage space. But Gateway Health for the longest time was owned privately by two partners equally. Highmark was 50% owner of our organization, and Trinity Health, formerly Mercy Health out in eastern Pennsylvania, they were both 50% owners of Gateway Health at the time. Late last year, there was a business transaction that took place where Highmark bought out the Trinity portion of Gateway Health. And so we have become now a wholly owned subsidiary of Highmark Health. But our passion and our mission has not changed. We embrace vulnerable Pennsylvanians as we have for 29 years. And as you can see, we embrace over 360,000 of those currently. We're based in Pittsburgh, Pennsylvania, southwestern Pennsylvania. That's where we've always been based. And you'll see that we have a very, very robust network for the area that we're in. Last time we checked, in terms of total providers, Highmark Home Care is proud to say that we have 29,000 providers contracted in our provider network. And we've listed some of what we call our Apex providers, which you'll see as Allegheny Health Network, otherwise known as AHN, UPMC, Penn State Health, and the Lehigh Valley Health Network. Those are, when we're talking about Apex providers, we're talking about, these are health systems that take on a bulk of the service delivery throughout our current footprint. and the providers who are associated with such health systems. And of course, we have a number of other community hospitals and so forth that are in federally qualified health centers and so forth that are also contracted with us in an effort to serve vulnerable Pennsylvanians. Some of the priorities we have as an organization, those have not changed. These have always been a focus of then Gateway Health, now Highmark Whole Care. We're in the day where we live in value-based strategies now are take precedent over just the volume of getting people into doctors' offices and other provider settings. For the longest time, it was all about get people in front of their provider. And in this day and age, that's done physically and virtually today in the world we operate in. But so that was one thing of getting people in front of a provider. Now, what happens in that encounter? What interventions are being deployed? What outcomes are being achieved? Are they desirable? And are there adjustments that have to be made? We've always been committed to make sure that members of our plans are in the right place at the right time for the right reasons. And we're doing that because it's the right thing to do. We have embraced a mission where our pathway to fiscal responsibility is through quality. If you squeeze one end of the balloon when trying to ration care or cut corners, you're going to end up with a bigger problem down the road. That's not fair to the individuals on our plan. That's not fair to the providers that we're contracted with. And it's certainly not fair to the taxpayers of Pennsylvania who pay for the managed Medicaid program in Pennsylvania. We're keenly interested in deploy care management innovation and resources. We're very passionate about that. We're constantly looking at ways of how do we do things faster, smarter, easier, and better in the interest of all the stakeholders we serve and the taxpayers included. Operational excellence is of paramount importance to us, not only in supporting our members and providers, but I should have added here community-based organizations who we partner with, who are responsible for bringing resources that are not clinical into the fold. Some of you may have heard the term social determinants of health. Community-based organizations bring a lot of resources to bear to address those social determinants of health in an effort to try to lower the overall cost trajectory and improve the overall health status of the individuals we serve. And then identifying and qualifying emerging risks. As you know, every time someone gets care, there's an associated insurance risk with that. It's one thing to look at the current episode, but today, in today's day and age, with the data that's available and the analytical tools that we have to our avail, we are now coming into a point in time where with credibility, we can project that Jane or John Doe has an 87% likelihood of presenting in the ER in the next 3 months for X. What we wanted to do is identify what is X and what are the precursors to that condition where we can meet that individual upstream, bend the cost curve earlier by being more proactive and preventive in the approach and in improving the overall quality of life. So that's what we're talking about in terms of emerging risk. So it's, again, a little bit about us and where we're coming from. Next slide, please. I think we got to go. We went backwards there. Can we go forward? Okay. So Health Choices program. Health Choices in Pennsylvania is the managed Medicaid program, if you will, in Pennsylvania. There are 3 distinct programs in that space. They're all called Health Choices. That's why we wanted to have a slide here just to point out what we're talking about today and contrast that a little bit with what the other 2 Health Choices programs are. So you'll see that, and this is in alphabetical order, no preference, but behavioral health choices addresses your mental health and substance abuse service delivery for people on medical assistance in Pennsylvania. That program is administered to the Office of Mental Health and Substance Abuse Services, otherwise known as OMSAS, under DHS. Then we have the Community Health Choices program, which is the newest of the 3 managed care approaches in Pennsylvania, which was first implemented back in January of 2018. So it's now going to be completing its 5th year of operation by the end of 2022. The focus of Community Health Choices is to address managed long-term service and support delivery, formerly known as managed long-term care back in the day. But the jurisdiction of Community Health Choices is under the Office of Long-Term Living under the Department of Human Services. And then what we're going to be talking about today is the Physical Health Choices Program, which Highmark Whole Care is a part of, and that's administered by the Office of Medical Assistance Programs, otherwise known as OMAP. So 3 distinctly different systems, different roles, different service delivery, in an effort to achieve desirable health outcomes for the Pennsylvania's vulnerable population, which right now totals about 3.2 million Pennsylvanians. So next slide, please. All right, so the new contract, as I mentioned earlier, September 1st is the magic date where the new contract will go into place. This is a result of a procurement that DHS, in this case, the Office of Medical Assistance Programs, or OMAP, conducted. It transcended over a number of years in order to get to this point. But as a result of that procurement, the state has chosen its physical health MCO options that it will move forward with for at least the next 5 years. And they've assigned various geographies to those managed care organizations. And we're going to talk a little bit more about what that landscape will look like and what it looks like now. But that's why we're moving forward with a new contract. This is really an unprecedented time in the Health Choices program. There's never been a transition like this as a result of a procurement. And you'll see what I mean as we go into some of these other slides. And a new contract period will result changing in the MCO options, which I mentioned before. DHS began sending out information to Medicaid MCO beneficiaries on June 22nd, and that started what's known as a self-selection process. Now, there are individuals who will have to make a change of an MCO, and then there will be others who will want maybe to make a change because of new choices available in their particular region. But the self-selection process commenced on June 22nd. You can see it will extend until August 16th. And then if someone has not selected a managed care plan that's operating in their zone, they will be auto-assigned effective August 17th or on August 17th for an effective date of September 1st. Per the Department of Human Services, or DHS, DHS is projecting that 60% of those who have to make a change will self-select a new MCO, and that 40% will be auto-assigned. When it comes to the auto-assignment, or for that matter, even those who self-select a plan, in medical assistance, there is no lock-in period for someone who joins a health plan like what you may find in commercial health insurance, where you have to stay on the plan for a year. People in medical assistance can change their health plan every month. Does that mean that that happens? No. Once, in our experience, over the last 29 plus years, when individuals and families find a home, if you will, as far as an MCO, the churn, if you will, the voluntary disenrollment going from one plan to another has historically been in the vicinity of about 1% or less. So, a little bit of clarification on that to the extent that that's helpful. And then as far as what we're doing, we've been partnering with our members and helping them understand what the changes are. Providers that we're contracted with, same thing, as well as community-based organizations, helping them understand what the changes are, because they're going to be asked questions, I'm sure, by those individuals, especially those who are going to be impacted. As far as the number of people impacted, you can see on the slide, 500,000 Pennsylvanians are going to be impacted where they have to make a choice of a new health plan. That's again one of the reasons why we wanted to do this presentation, because of the magnitude of the change. Next slide, please. Just a little bit of information on the timeline. I think I walked through that with you in the previous slide to an extent. This process began back in April. Again, letters were mailed out June 22nd, and they were done in 2 batches. And this was done by the Department of Human Services. The first batch went out to all the individuals and families who are going to have to make a choice. And we just heard this morning that as of July 7th, all the other individuals have been at least mailed information And of course, DHS is putting information out on their social media outlets and so forth to make people aware of this change and that and what the options are to individuals depending on whether or not you're impacted or non-impacted. And of course, September 1st. I will say that you may be getting questions even beyond September 1st because if we have 40% of those individuals who are auto-assigned, maybe they're assigned to a plan that they don't want. Can they change? Yes. They may be calling you to get some clarification on that. So again, and it's our expectation that within about 30 to 60 days beyond September 1st, there will be some dust, if you will, where people will probably be changing health plans if they're assigned to one they don't want or for one reason or another. But within about a 60-day period of time, we think that the enrollment will then restabilize as it has been historically. So, next slide. Okay, so for those of you who are unfamiliar with the physical health choices map, 5 distinct zones. You can see we've color coded all these for everybody's benefit and the plans that are currently available in each of those zones. Currently, Highmark Whole Care operates in the Northeast zone, the Southwest zone, and the Lehigh Capital zone. And then, of course, you see the green zone is Northeast, we're not there, or Southeast, we're not there either. But again, 5 distinct zones. You can see the plan offerings that are available in each one of those zones. But there will not be no zone will be left unaffected. About that on our next slide. So why don't we move there? All the current choices that you saw in the previous one are listed here, and you'll see that those choices are available up through August 31st of this year. For individuals who are on a health plan, no matter what it is, up through that date, for services rendered up through that date, the claims will be paid. There will not be any issues with that whatsoever. So let's go through this by zone, and I'll reference the picture on the right. What that shows is what our new service area will be effective 9/1. We will be in the Southwest and Lehigh Capital regions. Unfortunately, we will not be in the Northwest region effective 9/1. But you'll see that in Lehigh Capital, we will be available. AmeriHealth Caritas, UPMC, Aetna Better Health, and United. Those are all currently available. If you move to the right, effective September 1st, we will be available, AmeriHealth still, UPMC still. However, Aetna and United will be exiting the Lehigh Capital region, and they will be replaced by Geisinger Health Plan and Health Partners plans out of Philadelphia. Now, as far as the number of individuals who will be impacted in the Lehigh Capital Zone alone, that number is just north of 175,000, just in that region. So those of you who are working in districts that are in that Lehigh Capital region, you may have already begun getting calls or you will be getting calls. That's quite a few people for a 14-county area that have to make a change. Further down the list, you see Southwest. Again, you see the plans are available, us, UPMC, Aetna, and United. The new configuration was on the right. Again, it'll be us, UPMC, but in the Southwest, we will be going from 4 plans to 5, and 3 of them will be new. AmeriHealth Caritas will be entering the Southwest market, as will Geisinger and Health Partners plans. As far as the number of individuals who are impacted in the Southwest, that number is almost 116,000 in a 14-county area. So again, quite a bit of change in the Lehigh Cap and Southwest regions. Further down, Northwest, you see the current choices. There are 4. There will remain 4. However, AmeriHealth and UPMC will remain. Highmark, Northwest, and Geisinger and Health Partners plans will be the new plans in the Northwest region. Number of individuals impacted there is a little north of 47,000 in that Northwest region. Again, 2 new plans 3 new plans in Lehigh Cap, 2 in Southwest, 2 in Northwest, and then in Southeast, where there are 4 plans who currently operate, those being Health Partners, Keystone First, which is AmeriHealth's plan for Southeast, United Healthcare and Aetna, currently available. September 1st, you'll have Health Partners and Keystone First. United will be still there, but Geisinger and UPMC will be the new plans. So as what you find in Lehigh Cap, or I'm sorry, Southwest, 4 plans will become 5 and 2 will be new in the Southeast region of Health Choices. Total number of impacted individuals, and all these numbers I'm giving you were numbers of those enrolled as of 7/1. So these are pretty recent numbers. 97,000 plus individuals will need to choose a new health plan in the Southeast region. And then, of course, that leaves Northeast, where there are currently 3 plans. There will then now be 4. AmeriHealth, Geisinger, and Aetna are currently there. The new configuration will be AmeriHealth, Geisinger, Health Partners plans, and UPMC. So we will be going from 3 to 4, and 2 of those plans will be new. And those are impacted are just shy of 59,000 for that particular region. So in all total, we said 500,000 earlier. The exact number is 494,082 people will be impacted where they have to make a change through the as a result of this new contract implementation. Okay. Next slide, please. All right. So stakeholder impacts. The members are going to be impacted, obviously, directly. If you can see, United Healthcare members in Lehigh Cap, Southwest will have to select a new MCO. United is going to be confined to the southeastern zone of Health Choices. Again, August 16th is the magic deadline. 17th, there's an auto assignment. Aetna will be exiting the Commonwealth completely. They were all in all 5 zones previously. They will no longer be a health plan option in the Medicaid space in Pennsylvania effective September 1st. Of course, in our case, we will be exiting Northwest, but we will still be retaining Southwest and Lehigh Capital, which actually were our 2 biggest zones. So we'll be serving individuals in that 27 county area between those 2 regions. And again, you'll see all members will have an opportunity to choose their MCO or choose a different MCO if they'd like, because there will be new choices. They don't have to. If they're a non-impacted individual and they don't have to change, they don't have to do anything. They can just continue on. Life will continue to, it will be the same. What we want to make sure is that individuals choose a plan that's right for them in their region to ensure continuity of care, moving from one plan to another. And then you can see through the next stakeholder group, which is the providers. Our members are able to seek advice from their providers as far as guidance on which health plan might be best for them. So that's certainly an opportunity. If someone asks you, can I talk to my doctor about this? The answer is absolutely yes. Those who remain on our plan in the service area, there's nothing changing with our provider network at all. So people will be able to get the same care where they've been accustomed to doing. And then any new people who would either self-select or be auto-assigned to our plan will have the opportunity to work with the outstanding providers in our network. I do want to say too, with respect to auto-assigned, forgive me for not saying this earlier, sometimes we get a question is, well, how will they be auto-assigned? The department will simply take those who have not selected a plan, and they will divide that equally among the available plans in the region. So if you have 100,000 people who haven't selected and 5 plans, each of those plans will get 20,000 individuals assigned to their respective enrollments. Next slide, please. And then community-based organizations that work very closely with members of many of the plans, ours certainly included, will have the opportunity to offer counsel, from their experience as far as giving direction to members on determining what new health plan might be best for them. So, we're certainly, that's why we've been working with them closely too, to help them understand changes, and to the extent that they're encountered by individuals who have questions. We want to make sure that they have information available to them as well. And then we, as the managed care organizations, obviously directly impacted. We are preparing for the influx, if you will, of new members. We will certainly embrace them as we do everyone else to ensure that they are getting the care that they need, that we have all the information that we need from their previous plan, so that we're not starting over from scratch, that we can continue on with their care plan as what they've been accustomed to, moving on to our plan, or for that matter, any of the other plans that will be available. Next slide, please. All right, so in closing and in summary, what are we looking at here? Big change September 1st. All current MCO members will have the opportunity to select, but not all will have to select. As we talked about earlier, nearly 500,000 will have to select a new health plan. That self-selection process, again, commenced June 22nd, and it will conclude August 16th. Auto assignment starts and will commence on August 17th. And this slide here, DHS can still adjust the timeline. When we put together this slide, that was the case. That is no longer the case. Just so if anybody saw that, September 1st is the date etched in stone. Everything is locked down. They are moving forward with September 1st. So apologize for any confusion that may have caused when you read that. Couple other things that we wanted to make you aware of. This is a health choices transition affecting many lives. Coming up, when you look at the public health emergency that we've been working under for about 2.5 years, at some point in time, that will conclude. And as a result, Pennsylvania will be doing, DHS has been doing redeterminations, but they have not been dismissing anybody from the program, even if they're ineligible. And that is the case because during the public health emergency, states who made a decision to not dismiss people from medical assistance were given additional federal financial participation, or an FMAP, additional federal funds for their Medicaid program, in order to maintain people on the roll so they can get the care they need during the public health emergency. That's why the rolls have grown in Pennsylvania to about 3.2 million people. Again, that will come to a conclusion, and right now, we expect that there will be an extension until August or October 16th on the current public health emergency. We have reason to believe that it may be even extended through the end of the year, but at some point, either toward the end of this year or the beginning of next year, that public health emergency we do expect will probably be brought to its conclusion. And at that point in time, then DHS will continue with its redeterminations, but for those who are ineligible, they will be dismissed. From a public health standpoint, what our concern is to make sure that if someone is determined ineligible for medical assistance, is there some place for them to land? Could it be in Penny? Could it be, if you have kids in the CHIP program, could it be in some employer-based plan? That's what we've been talking to the Department of Human Services about. It's very important to them. We know that they're working extensively with the Pennsylvania Insurance Department to do form transfers as necessary, when they're necessary, to people to get into Penny, which is the subsidized health insurance marketplace in Pennsylvania. As of April, this is a little bit dated, but as of April 25th, DHS did report that right out of the gate, 900,000 people would need to be evaluated as far as their eligibility. Of course, over time, the entire denominator of those who are in medical assistance will be redetermined. But the department's intent is to, dismiss those who are ineligible within about a 6-month period or so. So we'll keep you apprised of the progress on that. And one of the things we will do is, once we understand when the PHE is going to end, and we have more clarity on the mechanics, if you will, of the unwinding of that public health emergency in terms of enrollment, we will put together another webinar like this for your benefit, so that you can be of service to your respective constituencies. Okay. So look out for that. We'll be making announcements as we get closer to whenever that public health emergency concludes. So I think we have one more slide. Key contacts. So here's some instructions. And again, this will be made available on our website. And in addition to some other materials that I'll talk to you about. So I look through my notes here. So you can see that there are going to be at least 3 different ways, or 4 different ways, 3 different ways on a person can choose a health plan. An individual cannot call a health plan directly and enroll. The department has a broker. They call it an independent enrollment broker. It's a company called Maximus. So you see the 800 number that is available for individuals to call the enrollment broker to make their selection of the MCO of their choice. They can also visit www.enrollnow.net, or they can download PA Enrollment Services mobile app available through the Apple App Store and the Google Play Store. We just got some information this morning from the department that, as I recall, about 8% of the total denominator, we're talking about people that have to make a choice, are going through those mobile apps. So again, something new for the department, and it's a sign of the times of the information age. But those are the opportunities that people have to choose their MCO through the enrollment broker. I had mentioned before that we will have materials available on our website after this webinar for to serve as a resource for you. Those resources will include the toolkit that DHS was to be sending out to all the legislative offices. We are making that available also on our website, the DHS toolkit, which has frequently asked questions and a bunch of other information as well. We have a one-pager for the Lehigh Capital region, which we will be in, tailored to the Lehigh Capital region to serve as a bit of a quick reference on the desk, if you will, so you can certainly download that. We will also have another one-pager for the Southwest region, which is tailored to that particular zone. We will have a recording of this presentation available, again, embedded in our website and or our YouTube channel. So please look for that. And so what you would do when you go onto highmarkholecare.com, you simply look at the tab that says About Highmark Whole Care, click on that. There'll be a drop-down box. You'll see a box that says Legislative Information. Click on that, and that's how you can get into the resources that I just described to you. Or if you're so moved, you can feel free to reach out to me as well directly. You can see my my contact information there, email and phone number. I'll be more than happy to further discuss anything with you. So let me stop there and conclude. Hannah, I would ask, do we have any questions in the chat at all?
Nothing in the chat. But
Okay.
if anybody has a question, feel free.
If anybody has a question, you want to unmute yourself, feel free to ask it. Any questions? Hopefully, what we had to share with you today has been helpful. Again, this is a transition that's going to take place over a period of time. So again, don't be a stranger. Please reach out. We want to be helpful. And if there are no questions, I think we could probably adjourn. I'll give it one more last call for questions. Okay. Well, again, thank you for your service to the Commonwealth. Thank you for your attention and time. I really appreciate it. And hopefully I'll get a chance to see some or all of you in person at some point in time. Have a wonderful day, and we'll see you down the road. Thank you.
Thank you.